restructuring. I think we need to continue our efforts to emphasize primary care to make sure every single person in the state has a medical home. I think you can help control costs. One of the problems we have with OPEB and some of the other issues we're having, obviously, is the future health care costs. It's eating our lunch with a constant rate of 12% medical inflation year after year after year. I think we can direct some effort, particularly toward guiding folks into medical homes where they see a doctor regularly. Again, I would hope that the overwhelming majority of folks, if they know that's an entitlement and benefit they're having, that they would access it.
I think we need to look at more in-home health care, training our nurses, more nurses trained in this state. Go visit in-home to take care of our elderly, take care of those needs, and maybe cut those costs.
You know, those same docs that choose to go back to their hometown or a small community out there see a disproportionate share of Medicaid patients, and therefore the reimbursement is very low. You know, one of my concerns is that unless we address that problem, that those same docs that have chosen to go back to a rural community may come to Charleston or Huntington or Morgantown to practice where they can make a good living. And I think that we need to look at it. If a particular doctor is taking a certain percentage of Medicaid patients, that perhaps their reimbursement rate would be higher in order to encourage them to stay in our rural communities. I think that's something we need to do and to be able to encourage our health professionals to stay in those rural areas of the state, because they're not conveniently get to a health center, we want to call the major cities of West Virginia.
One of the biggest problems is West Virginians are out of work. Our unemployment rate is 9.7%. 6 months ago it was 8.5%. So we're going the wrong direction. We need to put West Virginians back to work with good paying jobs with good benefits, including health care, and that'll solve some problems immediately rather than being concerned 4 or 5 years down the day, which we must be cognizant of. We need to start getting more aggressive with some of the things today. As governor, that's what I will do.
And I think, you know, we can afford as a state, and I'm sure Mr. Tomblin would agree, that we can afford, we can find the funds in some way just to have someone see a doctor. And a lot of times that's all they need is to see a doctor. They don't need surgery, they don't need OxyContin, they don't need fancy pills. You know, if they talk to a doctor, tell them what the problem is, you know, they're happy.
What I've found is, as I've talked with folks, is you know, the concerns that these gentlemen talk about, but also when it comes to dentists and care for pediatric patients. We only have 8 pediatric dentists in West Virginia. And I thought, wow, well, I know at least we have 2 of them along the boulevard that I could name, but their concern is, from that angle, is the bureaucracy and some of the red tape that they have to go through when it comes to filling out their Medicaid requirements for these children to be able to have, whether it's the x-rays or have some type of special care. And then that goes back to the beginning, is if we can't get these children into the dentist and get their dental health taken care of now, then later on they have poor dental health, they lose their teeth, they're not eating fresh fruits and vegetables, and you see what it continues to lead on to.